Do you know the 7 signs of a heart attack? Awareness is the first step to prevention, and today we're focusing on understanding the crucial signals our bodies may send us during a heart attack. These signs might be subtle, like a nagging discomfort in your chest, or more pronounced, such as a sudden shortness of breath. Recognizing these signs could make the difference between life and death. Stay tuned as we delve into each sign and arm ourselves with the knowledge that could potentially save lives. The first sign of a heart attack is chest discomfort. Now, when we say discomfort, it's not always an intense, sharp pain that you might expect. Rather, it can feel like an uncomfortable pressure, a squeezing sensation, or a fullness in the center of your chest. Imagine an elephant sitting on your chest. That's how it feels. This discomfort can last for more than a few minutes, or it can come and go. What sets this apart from other types of chest pain is its persistence and intensity. The discomfort doesn't ease when you change your body position or breathe deeply. It's also often accompanied by a sense of impending doom, a feeling that something isn't quite right. This is not a sign to be ignored or dismissed. If you or someone else experiences this type of chest discomfort, it's crucial to seek medical attention immediately. It could be the difference between life and death. The second sign of a heart attack is shortness of breath. This is a symptom that can present itself unexpectedly, and it can often be mistaken for a less serious condition, such as anxiety or fatigue. But here's the thing. Your body may be trying to tell you something important. Imagine you're walking up a flight of stairs, something you've done countless times before, but this time you're gasping for air halfway up. Or you're simply sitting and suddenly you're struggling to breathe. This isn't normal, folks. It's your body's way of signaling that your heart might not be getting the oxygen it needs, even without the presence of chest discomfort. Shortness of breath can also be accompanied by a feeling of tightness or a fullness in the chest area. You may even experience this symptom while at rest or during minimal physical activity. So remember, shortness of breath can be a serious sign. Don't brush it off. The third and fourth signs of a heart attack are discomfort in other areas of the body and breaking into a cold sweat. When we say discomfort in other areas, we're talking about a sensation that is not quite pain, but doesn't feel right either. This discomfort can be felt in one or both arms, the back, neck, jaw, or stomach. It's a sensation that's hard to pin down, like a dull ache or a heavy burden. It's not localized, but rather it seems to spread out, making it difficult to identify the exact source. And then there's the cold sweat. This isn't your typical perspiration from a workout or a hot day. It's a sudden, unexpected sweat when you're not exerting yourself or overheated. It feels clammy and uncomfortable, almost as if you've been doused with cold water. It's a sweat that sends a shiver down your spine, a harbinger of something not quite right. These symptoms can easily be misunderstood, so stay alert. The fifth and sixth signs of a heart attack are nausea and lightheadedness. These symptoms can be subtle but are extremely important to recognize. Nausea is a sensation of unease and discomfort in the upper stomach, often preceding vomiting. But how does it relate to a heart attack? Well, during a heart attack, the blood supply to part of your heart is blocked, and this can cause a feeling of fullness or choking, which may be mistaken for heartburn or indigestion, leading to feelings of nausea. Lightheadedness, on the other hand, can make you feel like you are about to faint. This happens because your brain isn't getting enough blood. And remember, during a heart attack, blood flow can be restricted. You might feel dizzy, unsteady, or like you're losing your balance. These symptoms might be easily dismissed as something less serious like dehydration or a minor digestive issue. But it's crucial to remember that when these symptoms are combined with any of the signs we've already discussed, such as chest discomfort or shortness of breath, it could be a sign of something far more severe. If you feel sick or dizzy, especially along with any other symptoms we've discussed, it's time to take it seriously. The seventh sign of a heart attack is fatigue. Now, we're not talking about the kind of fatigue that follows a long, hard day at work or a sleepless night. This is a fatigue that feels heavier, deeper, and more persistent. It's like a shadow that hangs over you, even when you've had plenty of rest. It's a draining exhaustion that can make even the simplest tasks feel like climbing a mountain. This fatigue can be a sign of your heart struggling to pump blood efficiently due to a blockage in your arteries. Your heart, in essence, is working overtime just to keep up with the body's demands, and this can leave you feeling constantly worn out. Unlike typical tiredness, this fatigue doesn't necessarily get better with rest. It can persist for days or even weeks leading up to a heart attack. It's as if your body is waving a red flag, urging you to pay attention to something that's not quite right. It's important to note that this fatigue often doesn't exist in isolation. It may accompany other signs like chest discomfort or shortness of breath. So if you notice a sudden onset of unexplained extreme fatigue, especially if it's paired with other symptoms we've discussed, it's crucial to seek immediate medical attention. Unexplained or extreme fatigue requires immediate attention. Remember, it's better to be safe than sorry. Let's quickly recap the 7 signs of a heart attack. First, we discussed chest discomfort, often described as an uncomfortable pressure, squeezing, fullness, or pain in the center of the chest. Next, we touched on shortness of breath, a symptom that can occur with or without chest discomfort. We then delved into discomfort in other areas of the body, such as the arms, back, neck, jaw, or stomach, and the sudden onset of a cold sweat. We also highlighted the importance of recognizing nausea and lightheadedness as potential signs of a heart attack. Lastly, we explored fatigue, an often overlooked but critical symptom, especially in women. Each of these signs is a potential red flag, and anyone experiencing them should seek immediate medical attention. Remember, understanding these signs could make a life-saving difference. Stay informed, stay vigilant, and take care of your heart.